The manifestation of healing has been a topic for many years. Um, and I think that everybody knows the law of attraction, which is very often used to gain more wealth, even also to gain more health. But this law of attraction very often fails. So I was in the search what would be the factor that makes the law of attraction fail. And like the last 10 years or so, I came across the law of assumption. This will be the topic of this presentation, how we can use the law of assumption for healing and happiness. Well, I'm Volker Meissner. I've been a physician for more than 40 years already. I'm the owner of the Clinic of Holistic Medicine in Königswinter, close to Bonn, the former capital, Germany. I'm the CEO of Limited, mit Absicht gesund, which is translated into intentionally healthy. This is the motto of my practice and of this center. And I'm the president of the German Academy for Energy Medicine and Bioenergetics. We had a congress 2 weeks ago, and we talked a lot about self-healing and manifestation of healing. So you get quite the results of this congress also. What I'm going to tell here is always my view, so nobody is forced to join me in what I'm teaching. I think that some know me already and they will recognize this. There are two ways. There's a paradigm shift, and so I hope so. We have the old paradigm, which is disease-centered, where the pathogenesis is in the foreground, and the major purpose is to repair people. So how does disease work is the major pattern on the left side. And this will leave us with some not so healthy things. So in the left side, the patient is more a customer than really a patient taken care of. On the right side, so the new paradigm, there is health. And then we concentrate on how does health work. So there's salutogenesis, the opposite, which is a bit more complicated than how disease works. But anyway, it's the nicer word. And when we go from health, then we end up in healing. On the left side, you remain in a status that's called sub-health. So it's just below health. You're not going to be really healthy. It's just below that state. And so you keep being a customer. I think this the intention of this was the first health market. On the right side, we have already health and we have already healing. So what's down there? That's happiness. And that's why I try to educate my patients not to look for health, but for happiness, which will include health and healing. On the left side, okay, you can use this when you have a flu or minor fractures or short-term diseases, no problem. Then you are repaired, return to duty, and the thing is done. On the right side, there's a difference. This is definitely required when you're dealing with systematic things, when you have autoimmune processes running, autoimmune diseases, or when you have major injuries. So when you are not only have some more wounds or so, but when you're really ill, when you feel really ill, that changes the character of the person. We need a different approach than on the left-hand side is given. You always have to know where would you like to go? What is your destination? What is your real destination? And some destinations are illusionary. So the first one is that health could be a real goal. And I always say, no, health is not really a goal. It's an intermediate goal, of course, intermediate target. So you can have it as a next stop, but it's not the end. The end should always be healing. So main goal when I talk to my patients, the main goal is healing, not just being healthy. It's a bit different, but at the end, it's just the better way. And so we have here This healing curve, I think some of you will remember. So we start at point number 1, and then at point number 3, we are quite okay. Means many people take off, they stop pressing the accelerator, and then they go down the yellow line. I ask my patients to keep the accelerator pressed and then go to number 4. So on the number 1, you are a patient. And what are we doing with the patient? We have therapy. We treat them. But therapy is only applicable, or let's say effective, until point number 3. Above number 3, there is no treatment, there's no therapy, because there is nothing you would like to escape from. So the pain is low, it's mediocre, you can stand, this is not a problem, so you can live with that. But this is not the aim. The aim is always take this deposit of health and resilience, go up to number 5, and you can do this only by coaching or mentoring. This is not done by treatment. So at the end of this curve of number 5, you have taken off the identity of being a patient, and then you acquired the identity of a happy me. This is quite a journey, very interesting journey, but it's always very a pleasure to see people going up to number 5. So how can we get there? So that's why I invented, so to say, the Healing GPS, which is not an app. It looks like this, but it's not an app. It's a mental program. And like in a normal navigator, GPS system, we type in the goal. And then we get in this goal and turn around, and then we say, how did we get there? Or from the beginning, how will I have got there? So this is the major problem. So when you look from number 5 back to number 1 or 2, you can see what was the therapy required to number 3, what was mentoring and coaching from number 5. And we have this approach because we distinguish between the causes and the reasons. So I think that you have seen this many times. So we have this, our focus, our mind, thinking mind, and we have the subconscious part. 5% above the line, 95% below the line. If this was an iceberg, you see the wind on the left side and the current on the right side. And I think you will agree that this iceberg would follow the current. We can take this metaphor and you would say on the wind side, we have our goals, our intention, our rituals, our focusing. And on the right side, on the current side, we have this more subconscious working things, the mindset, our bad habits, our addictions, our traumas or traumata, and all the imprints that we received through education. And I think everybody agrees that we have to work on the right side first before we can achieve anything better on the left side. That's why we have to be aware of the causes of the diseases, that we have to do some homework, that we have to get out of our comfort zone. You will not achieve a big goal inside your comfort zone. Then we have to have the inner image of being healed already. So the healing has already happened. This is the state we are when we were there. On the right side, we have the causes of the disease. Very in the deep grounds. And on the lower part, we have the blockages of the healing. So there are 2 different factors here. The causes of a disease is not necessarily a blockage of the healing. It can be very different things. Next one. And we distinguish between symptoms, causes, and reasons. The symptoms is clear, so that's why people go to the doctor. The causes are activating the symptoms, and the reasons are activating the causes that fire up the symptoms. So I will give two examples. When you have a patient with a sciatic nerve syndrome, so the pain running down the leg, you have a diagnosis, and then you will find a slipped disc, for example. And normally for the orthopedic surgeon, this is enough, and will stop and will start treatment. When patients come to me, I would say, oh, what is breaking this person's back? So what is the major problem behind the slipped disc? And then we find out that there is an unbearable life, that he has too many stones and bricks in his backpack, carrying the loads of other people's lives. So if you do not treat this unbearable life, if you don't treat the reasons or the causes, then there will be a next slip disc 6 months later, maybe not in the lower back, maybe in the cervical spine. But if this problem is not solved, it will reoccur many times. Another example, which is not known so often, so if you have a heart rhythm disorder, atrial fibrillation, for example, this could be caused by blocked vertebra, especially C1, C2, or C0, 1, and 2, the upper sections. And you can manipulate this. You can have an osteopathic intervention, which is very helpful. But in this case, also, you have to look for the reasons behind the blocked vertebra. This could be, for example, a lack of orientation, or a person who can't think in a different way than he does already. So he's very stiff in his neck. This is the opposite of this lack of orientation, where there's no real direction. Both of them are really very often seen examples of this triad of symptoms, causes, and reasons. And that's, I have this incorporated in my work. And of course, I'm working with the right column here. I'm focusing on salutogenesis, because this has to do with self-healing. And for self-healing, we have two laws: the law of attraction and the law of assumption. And there are not so many people who know the law of assumption at all. It's not so common law. The law of attraction, I think everybody knows this because of the movie The Secret. Everybody knows this law, but it fails very often. And I will show you the difference between the two and why I prefer the law of assumption. When you use the law of attraction, then you wish something. So the heart is radiating the wish to the universe, but the mind has still some doubts or argues from a needy perspective. So I want to have this because I don't have it. If you broadcast this, I don't have it, so the lack, and there's some doubt, you will get a mixed result. Of course, you will maybe have the result 70%, 75% of your wish fulfilled, but there's this 25% of the doubt. So you get more doubt. This is the law of attraction. This is the major trap that you have with the law of attraction. But so if you go to the law of assumption, it's a different way. So before you broadcast your wish, mind and heart come together, form kind of an alliance. They form the feeling of the state of the wish already fulfilled. So you are 100% in the goal in number 5 of the healing curve. You know, on the right upper part. So you are already there. That's why your result is 100% wish fulfilled. There's no distraction. There's nothing that could disturb or distort the signal you are broadcasting. So when you take the law of attraction, you have a vision board. So you draw all the things, you have a collage, whatever. You present your wish, and then, like a missile, fire and forget. You have to have positive thinking so you can have the vision. Of course, you're saying, I want this and that, or I'm going to achieve this process. I'm going to achieve this goal, this ECO process. This is the law of attraction. And you have done it once. Maybe you have your vision board. You look at the vision board once a day or once a week, whatever. It's a more static display. On the other side, when you go to the law of assumption, of course you have goals also. Yeah, making interesting journeys also. But you don't have only one wish and fire and forget. So you do a daily practice. So you stay there, you stay hooked. It's not 15, 30, 45 minutes. No, it's a 2 or 3 minute practice per day. And what is to accomplish is you find a place, virtual place, you can imagine the place, no problem. Without any distraction, you're concentrated, focused on that place. You calm down your brain in the alpha state, so between 8 and 14 hertz, about 10 hertz, let's say. And then you create a meditative state. And once you are there, then the real procedure begins. You let your desire appear in front of your mind's eye. That means that you experience the feeling also of the wish to be fulfilled. You have a clear vision of that state. The wish is fulfilled. Your basis is trust, faith. And there are three formulas that you can use. Maybe there's some more, but this is the three major formulas I offer to my patients. The first one is, I'm happy and grateful that this, if this is a problem, acute problem, this too will unfold to my highest good. Notice when you really have an acute problem, when something is in disbalance, you say, I'm happy and grateful that this too will unfold to my highest good. Or go to number 5 or the end. I'm happy and grateful that everything or this has unfolded to my highest good. So the first is more for the skeptics. Of course, this will unfold. And the second one is that you are really faithful. And then you say that has already unfolded to my highest good. And if you don't know what is your highest good and you are not sure whether the universe knows, you can say, I'm happy and grateful that everything has unfolded in the way I had desired. So you give your wish a bit more force and declare your wish to a desire, which is a bit really different. When you have a desire, you know it's you who is responsible. If you just have a wish, or maybe some other person or higher element is responsible to fulfill your wish. But when you get out of this wish level and you go to the desire level, you are the person who is in charge. And you can take over responsibility. So we come here in a conclusion of several things when you go to integrative medicine or adaptive medicine, whatever new medicine. We meet quantum physics here. Now more and more scientists, quantum physicists say, of course, we know how this works, how the information field works, how we work with energies, that matter is just compressed energy and put together with some information. There's more and more research done. So we have the quantum biology as well. And then we have the psycho-neuroendocrine immunology, which is a big part of the way I'm doing my work. This combination of the psyche, of the nervous system, the endocrine system, and the immune system. At the end, we have heart and brain together. We don't separate this. We have them hand in hand. And so that's why we are able to work holistic. We have this awareness, this mindful approach to our patients. We have this appreciation against our patients, vice versa. And we know that there are lots of processes, and these processes are intended. So knowing this, we can go on. And one of the major factors is mindfulness, awareness and mindfulness. When we live a mindful life, then healing is very close. Then we can act mindfully. We will find the proper nutrition. We will find the amount of physical exercise we need. We will end up in a work-life blend or work-life balance, as we say. And this last sentence, I think you know already, do what you love, or at least love what you're doing. And this is a motto, intentionally healthy. It's just deciding to have proper mindful living. Everybody has their own map of what is real, of what they think is real. So reality is not one thing. Reality is just a map. Everybody has their own map, their own reality. There are only 2% input, 98% computing. So we don't see the world like it is. It's like we see it. We have a lot computed in. So everybody has their own screen, has their own map of what is. This, in many cases, is formed by this circle. So we have thoughts, we have emotions. These emotions lead to actions. These actions give us experiences and causes the next thoughts. And this BS container, you could say, is a belief system, DS, or you can call it bullshit. It's the same thing. It's both worthwhile thinking about that. And we have to think here in a different way. Normally, you find yourself in the trap of an emotion. So I'm feeling bad, I'm feeling sad, or whatever. But this is step number 2. So you have to ask yourself, what do I need to think to feel that way? Which thoughts have caused this bad experience? And the thought is the only way, the only place where you can change things. But these thoughts are involved by the bullshit, by the belief system. That's why we want to skip that. So, the first thing is that we concentrate on the end in mind. We start calculating from the end. How will I have got there? Remember. And we have this formula, I'm so happy and grateful that everything unfolded to my highest good. This is the mantra in number 5. So how can we get there? How would a new person living in number 5 cope with problems? How would this new person achieve goals? So you can think of that new person and say, okay, stop complaining, or would act solution-oriented and would make plans, would set goals and come to action, and let's say bans excuses. So no more excuses. You can say, what capacities and strengths does this new person in number 5 need to easily make dreams come true, and what capacities do they have that are missing in my current life? Which do I have to achieve? and you have a list, focus, distance, and flexibility. And what you really need is, if you don't have it right now, focus and consistency. The major factors, of course. So what good habits do they show, and what bad habits did they let go of? This is the transition process from current state to the desired state in number 5. So we can have, for example, decide to have a morning ritual, some physical exercises, some proper meals. We do without alcohol, without sugar, and of course without blaming, taking full responsibility for our life at any time, at any second of our life. And for the morning ritual, you see there maybe could be a meditation or a gratitude process. You can do some reading good books, and some people are journaling, and of course you have a proper breakfast. Just examples there is. So what fears did you let go of? And what shows up in the present time? So what are the differences from my current state to the future state? And the future state is the happy me. So you just ban all these experiences, you clear them. It's not good enough things, 48,000 ways of feeling not good enough. You can just get rid of them. And of course, you may evolve in a person which is more charismatic, which is self-confident, and which is more benevolent, who doesn't judge, who is not attached, who is just benevolent. So the law of assumption has this clear vision of the state, wish fulfilled. Everything is done. Everything has unfolded to my highest good. The basis is trust. And many people lack in trust. That's the first thing that we need to learn. So we have the therapy here. We have mentoring, the coaching there. And my patients learn especially the way from 3 to number 5. How can we cooperate so we have a clear connection in our hearts? The heart is the major healing tool. This connection between the heart of the patient, the heart of the therapist, this is the bridge. And we have 2 major sentences, and those who have heard me already, I think they will recall. I love and appreciate myself just as I am. There's no space for not good enough. I love and appreciate myself just as I am. And the mantra, I give myself the explicit permission to live a joyful and happy life. This is the major mantra. You can say it 100 times a day if you need. And it's all based on love. And love is not only human. You find love everywhere. You find love even in these giant cats. Of course, and whenever you want to be happy, it's just at the next exit. There to leave your road and go. If you want to know more about this law of assumption, just drop me a line or call me or take the book, a phone call with me using the QR code or the link given. Thank you very much for your attention. And if there are any questions, I'd be happy